This video is designed to help patients in Saskatchewan learn about the important things they need to know before and after a total joint replacement. The video lessons and steps outlined by the Saskatchewan Hip and Knee Pathway are designed to help patients through the process of the surgery and onto a healthy recovery. In this module, you will get an overview of pre-surgery exercises.
So your book here shows the exercises that you should be doing before your surgery, and the first one we're going to start with is this knee leg press. Okay, remember, when you're doing these exercises, you should try to do 3 sets of 10 repetitions. So that'll be 30 exercises in total. However, you're going to break those up into 10 little batches. The knee leg press, you're going to take some kind of a belt or a band or anything like that. You're going to hook it around your foot like this, okay? Then I want you to pull with the belt and your hands as you slide your foot up towards your buttock. And as you're pushing out, give yourself some resistance so you build some strength. Let's try that once more. And give yourself some resistance. So the second one is your quads over the roll, or straightening your knee, okay? So you can use an old coffee can, you can roll up some towels, or if you happen to have a roll like this will all work for this exercise. Put this roll underneath your knee, like that. Make sure you're in a comfortable position. If you need to put your head down, that's good. You're going to try to do 3 sets of 10 repetitions of exercises. So what you're going to do here is you're just going to lift the bottom part of your leg up and then back down. To make this exercise a little bit more so that you get more strength in here, you can pull your toes forward, lift up hard, and think about pushing your knee into the roll. And then back down and back up again. Very good. So we're going to do this exercise now to help strengthen the back of your hamstring, the back of your leg, as well as do a little bit of hip strengthening for you. This exercise is called the standing hamstring in your book. So you're going to use a chair just for balance. Just face the chair, hold on to it so you don't tip forward or backwards. When you're doing this exercise, try to keep this hip as straight as you can. Don't let this bend at all, okay? Keep that straight. Put your weight on the opposite hip over here and bring your heel up towards your buttock. Perfect. Back down and do that again for me. Perfect. As you're doing that, it's not bad to just tighten your tummy a little bit just to keep solid. And you're going to repeat that 10 times. Very good. So this exercise is called standing abduction in your booklet. Okay, so what we're going to use this exercise for is to help strengthen the muscles on the side of your hip. So I'm going to get you to stand with just your hand against that chair just for balance. When you're doing this exercise, make sure you don't lean over at all as you're doing the exercise. Stay straight up and down, okay? So the exercise is going to bring this leg out towards me that way. Perfect, and back down. And try that once more. Perfect. As you do that exercise, just tighten your tummy a little bit. Good. And now make sure that you don't rotate this hip. Don't turn that hip out that way as you're coming up, because you're not strengthening the muscles we want. So just keep it straight. Keep your toes pointed straight ahead as you do that, and come on back down. So this exercise in your booklet is called toe raises. Okay, this will be what you're doing before surgery to help strengthen your whole lower extremities, your legs, primarily your calves. So if I get you just to face the chair, you're going to hold on to the chair to make sure you have a good balance there. When you're doing this exercise, make sure you don't lean forward into the chair at all, that you stand straight up and stay that way. The exercise is quite easy. All you're going to do is push up onto your toes. Bring your heels off the ground and push onto your toes. Go on back down. You're going to do 10 repetitions of that exercise. Hold for the count of 5. Go back down. Do 10 repetitions. This exercise in your book is called the chair push-ups. This is an exercise that will help you strengthen your arms so that after surgery, when you're getting out of a chair up and down, it'll help you to push, and it'll also help you to strengthen your legs a little bit and get those two activities in unison. What you're going to do is just put your arms on the hands of the chair. You're going to just push up as you're standing forward. And now lean back down. As you push up out of the chair, you want to hold that for 5 seconds and then lower yourself back down and repeat that 10 times.